Bon après-midi et bienvenue. Good afternoon and welcome to our second interactive webcast of the day for RTO ERO members. My name is Muriel Howden. I am the Executive Assistant and Senior Outreach Advisor in the Executive Office of RTO ERO, and I will be your moderator for the webcast. If this is your first time participating in a webcast, I will explain some of the logistics of how everything works. But first, I want to introduce you to the speakers for this afternoon's event. So our panelists today are Martha Foster, who's the president of our organization for 2016 and 17. Hello, Martha.
Bonjour.
Bonjour. And next to Martha is Gail Manley, who's the chair of our Health Services and Insurance Committee. Hello, Gail.
Hello and bonjour.
And bonjour. Comment ça va?
Très bien, merci.
Excellent, thank you. So before we jump into the presentations with Martha and Gail, I want to review a few tips and details that will be helpful, especially if this is your first webcast. So first, if at any time you experience technical difficulties and need support, use the Having Trouble link on your registration page. You can email your support question in either language, French and English, and we'll respond accordingly. You can participate in the webcast in your language of choice, as we said. So on the screen, you will see the URLs of both the English and the French versions of this webcast. So take the time now to switch over to the language of your choice if the webcast you joined was not your first preference. So you can ask a question, make a comment at any time. The question box and submit button is at the bottom of your screen. The webcast will be archived on the RTO ERO website in the video section. We'll give you more information at the end of the webcast about accessing the archive, but I just wanted to let you know now so that you don't worry about missing anything or taking too many notes. So now that we have all an idea about how the webcast works, we're really ready to get busy with our topic for this afternoon. And President Martha Foster, lead things off. Martha.
Thank you, Muriel. Welcome to all of you that are joining us here today. The way this next hour is going to break down is this. I am going to provide you with an overview of the strategic planning context for the organization. Then Gail is going to speak about our insurance plans and about the actual enrollment campaign that's going on right now. She will take you back to how the campaign got started, and then she's going to share some of the frequently asked questions that we've been receiving and important key messages that we're sharing. And then we expect to have at least a half an hour devoted to your questions and your comments. And you can submit them at any time, as Muriel just mentioned. To make the flow of the webcast go smoothly and to give you time to formulate your questions, we will answer all questions at the end of the presentation. This webcast is happening to provide one more venue to engage with our members on the important topic of the current open enrollment campaign that RTO ERO is offering for members and for prospective members who choose individual or who did choose individual insurance plans upon their retirement. So it is only with your help that we can create a sense of cohesion, a common purpose, and a shared vision so necessary for us to have a successful organization. The shared vision and the common purpose come through a well-executed strategic plan, which is what I'm about to share with you now. Our strategic plan, and actually it's on the screen, our strategic plan has been developed taking direction from our district leaders and from you, the members. If we have strategic goals to be the trusted voice for the broader education community, to improve the lives of our members and seniors, and to broaden the membership base, then our activities and our services must be aligned to these strategic goals. We have a mission as an organization to improve the lives of not only our members, but seniors, and it guides all our priorities. We are focused on what matters most. The journey into and throughout retirement is different for everyone. What makes us different is our ability to respond to those needs and the way in which we respond. That is absolutely what we're trying to do with this open enrollment. This effort is for members and for prospective members who chose the individual insurance plans upon retirement. But back to the topic at hand. Gail Manley, the chair of the HSIC committee, is now going to talk about the actual campaign from its inception. Gail.
Thank you. Thanks, Martha, very much. Well, to give some context to our discussions, I'd like to give you a sense of the Health Services and Insurance Committee, how we make our decisions, how this relates to the strategic plan. Obviously, it does help with improving the lives and benefiting members and seniors. But we also need to delve in into why we chose this open enrollment timing. Well, for the remainder of the webcast, rather than go through calling my committee the Health Services and Insurance Committee, I'll refer to it as the HSIC. So, the HSIC is composed of 10 RTO-ERO members, including 3 members of our elected provincial executive. So it's the president, the first vice president, and the second vice president. The HSIC meets 5 times per year and determines the premium rates our members pay, as well as the plan design of our extended health care, semi-private hospital, and dental plans. We also determine which company will share the risk with us, who we will utilize for consulting, administration and claims adjudication. Sorry, I'm going to need water.
Break. We're having a break.
Not good, but here we go. I think I'll keep this with me. So we have the ability to choose the underwriter, the insurer, and also who does our consulting. At this point in time, we have Johnson Insurance as our consultants and claims adjudicators, as well as Sun Life as our underwriter. The other piece that I'd like to let you know is that members can submit suggestions for changes to the plan design. And the committee has just met today, as a matter of fact, to start the suggestions that were sent in last year. So when we say, and we're very proud to say, we truly have a plan that is designed and run by members for members. So this time last year, we had another open enrollment, and I sat in this very room with Muriel and last year's President Martin talking about it at that time. However, the open enrollment at that time was exclusively for members and prospective RTO-ERO members who were insured through the RTIP-ARM individual insurance plans offered by OTIP. So this happened in direct response to inquiries we were receiving at the time because their insurance plans, the RTIP-ARM insurance plans, experienced significant changes in coverage and rates. Since that time, hundreds of those individual insurance policy holders transferred their coverage to RTO-ERO. So we opened a window then, because it's more difficult than just automatically transferring policyholders to RTO-ERO, because they were in individual insurance plans, and we are a group insurance plan. So to put it in simple terms, you can transfer from one group insurance plan to another, as you do when you leave education. But if you transfer from an individual insurance plan, you're subject to a medical questionnaire. So in fact, that's what we call open enrollment. We are opening it without needing a medical questionnaire for people going from individual to group, which is our plan. So I'm sure you're sitting there saying, okay, how do I know what type of plan I'm in, whether it's group or individual? Well, it's fairly simple because in Ontario and Quebec, group insurance plans have to charge provincial retail sales tax on their premium. So 8% in Ontario and 9% in Quebec. Individual insurance plans do not have to charge this tax. So you would just probably know from what you pay and your monthly premiums, you would be able to tell. So when we opened the window for RTIP-ARM policyholders last year, we received a number of inquiries from members and prospective members who were in other individual insurance plans, who also wanted to participate. However, at that time, the window had a specific purpose, and that was just for the RTIP ARM policyholders. So this year, we were very happy, we're very pleased with the product that we have to present to people in efforts to improve the lives of members and seniors. And so we were happy to be able to respond in a positive way to those requests we received last year. So we've opened another window, the HSIC. It began on February the 1st and runs until April 30th of this year. So if you know of someone who is traveling and won't be back until after the April 30th deadline, just ask them to contact us in advance of the April 30th deadline, and we'll work with them to provide assistance, as long as we know they have that intent. Now this window, you say, well, who's eligible? The window is open to members of RTO ERO, and also anyone who is otherwise eligible as a member of RTO ERO, who is currently enrolled in an individual insurance plan. And at this point in time, because it's an open window, they are able to transfer to us with the plans they currently have. And that's a part we really want to emphasize. It's not getting a different type of plan. It's if they come from an extended health plan and in their individual coverage, they can come to an extended health plan with the group insurance. Now, if they did not carry that coverage, then entrance is subject to the same requirements as anyone, so that they must complete and pass a medical questionnaire. As always, late entrance into our dental plan can happen at any time. And how we don't actually have a medical questionnaire, but in the first year, reimbursement is limited to $500 per person. So at this point, I'm going to turn it back to Martha to speak briefly as to what is happening with the open enrollment campaign from now through the end of April. And then we'll all look forward to answering your questions. Remember, you can submit your questions now. Thank you.
Thank you, Gail. Well, we know that when it comes to recruitment and outreach, there is nobody better than you. Our members are the most important ambassadors that we have, and this campaign is no different. We're asking you, our members, to contact your friends and your colleagues who are eligible, either as members of RTO, and that these are individuals that you know don't have RTO insurance, are with an individual insurance. Let them know that this window is open and that they can move over without a medical. In addition to and I said members, but also to non-RTO members, but those individuals who are eligible to be RTO members. So they're not RTO members now, but they fit the qualifications. They either work in a college or a university, formerly were teachers, they worked for the school board. Those individuals can, if they're eligible, can move their insurance over too. So these are the people we're looking for. You know who they are, and we need you to make those contacts for us. In addition to the 2 email messages that we've sent out to members, we've developed web pages specifically for this campaign. Now, I know that you often speak to individuals who are comparison shopping. You may feel that you are in an awkward situation, you don't have all the data and all the information. You've got the web pages that you can send them to. Offer that sales pitch for RTO ERO. The page is available in both French and English, and it discusses the key components of our 2017 open enrollment for RTO ERO's group insurance plan. It's important for us to get this message out through as many channels as we can. Over the next 3 months, you're going to see us communicating in many different ways. You might get tired of hearing from us, but we need to get the message out there. Many of you have already received a couple of emails. There will be a few more to keep you updated as the campaign moves along and so that you don't forget about it. And we're going to ask you to share the landing pages, follow us on social media, and subscribe to our YouTube channel. We are always sharing information on a variety of topics, not just this. There are other things there too, so it's a good place to be. the retirement journey is very different for everyone. We also know that the power of the person-to-person conversations that happen between friends and colleagues in your communities, we know that. And because of that, we're also interested in hearing from you about the questions and comments that you hear in the communities. Please share those with us at insurance@rto-aro.org. What you hear will help us to shape the collective message that we're sending out, and it helps us respond to questions in a way that provides the best and hopefully most understandable answers. So we're almost ready for our question and answer session. To recap briefly, the open enrollment window is available to members and prospective members of RTO-ERO who chose an individual insurance plan in their retirement. They are able to transfer to us into the same coverages that they currently have. If they do not currently carry that coverage, then the entrance into RTO-ERO insurance is subject to the same requirement as anyone else without that plan. They must complete and pass a medical questionnaire. As always, late entrance into our dental plan can happen at any time, with the stipulation that the first year's reimbursement is limited to $500 per person. That's the recap. So now let's get the questions, and I'm going to turn it back to Muriel.
Thank you so much. Thank you, Martha. Thank you, Gail. So now this is the portion of the webcast where we are going to take your questions and your comments. So just as we discussed before, just a reminder that the question box is immediately below the screen where you are viewing our panelists. So type in your questions and comments and then submit. You can submit your question in French or in English. If we have more questions than we can respond to in the time that we have available, we will respond to all questions, either individually or as a group through the archive. So please don't worry, and we're really, really happy to get your question now. So I see that we have our first question that has come, and the question goes, I'm already an RTO-ERO member, but I have my insurance elsewhere. Do I need to apply for membership again? Martha?
No. Once you're a member, you're a member. You do not have to reapply. All you need to do is to follow the process, contact the office, and change your insurance over. And I know that's exactly what you want to do. So,
perfect. Thank you very much. So I see we have our second question of the day. Thank you so much. So the question goes, is one of the requirements for eligibility to join RTO-ERO membership and health insurance plans that the person has to be eligible to receive or is receiving a pension? For example, OTPP or OMERS? Question mark. So, Gail.
I guess simply put, no, that it's much broader than that. Membership is anyone that's retired from working in education. So you could have early childhood educators, you could have post-secondary, anyone support staff. It doesn't necessarily have to be receiving an OTPP pension. It's essentially, it's retired from working in education. So
Broader education sector.
Yeah.
Thank you very much, Gail. Another question has come. Did we see this one already?
Yes.
I think we have seen.
No, this is different.
This is different.
In the insurance plan.
So let's see. I'm already enrolled in the RTO-ERO insurance plan. Do I need to sign up for the insurance again? So this time the insurance again. So Martha, do you want to take this one?
I get the no questions? Oh, you had one too.
I had one.
No, you don't. What, you've got our insurance, you're in. This is just for those people who aren't a part of our insurance plan so that they could be members or have the potential to be members. They can now move their individual insurance to our group insurance. Those of you who are in, you're in.
Fantastic. Thank you, Martha. So I see that, okay, so another question has come. Again, thank you so much for this question, Cummings. This is fantastic. So I'm planning to retire during the open enrollment period. So meaning retiring between February 1st to April 30th. Does this opportunity apply to me? Gail?
Well, essentially, if you're in a group plan right now and you're teaching with a school board or in education, you don't even have to worry about our open enrollment window that's kind of special right now, because you're going from a group insurance plan to our group insurance plan. So basically, you don't have to think about this. As long as you apply for RTO Euro insurance and membership within 60 days of when your group insurance plan terminates. So that's all there is to it. You really don't need to wait for this open window. You have one.
Very good, thank you. And our next question is, what is the cost and is it deducted monthly? So, Martha, do you want to take this?
Sure.
Do you want to get?
Sure. Yeah, the answer is yes. I got a yes question.
Yeah.
Okay, so yes, it is deducted monthly. And it depends, because we have such a broad range of individuals who belong to RTO. If you have OTPP, then it's deducted monthly from that. If you have a teacher's pension, or it can come from your bank account, for anyone who doesn't have a pension that we can draw it from. The rates I can't give you the cost, because that changes with your background, and it also changes with whether you choose a single or a couple or a family. So that varies, but yes, it is deducted monthly.
But for the person asking the question, I think you probably should, if you are interested to know how much the rates are, then I would say call RTO Euro, or and I can do that one off by heart, 1-800-3, oh no, maybe I can't, 368.
You'll get all the information
The information's
at
at the end, sorry. Or call Johnson Insurance, but probably best to get the connection through RTO.
Yeah, member services will
if you are a member now, then it'll be in your little day planner, your little book too.
That's right. And the next question I see has come in, and Gail, I know you addressed it a bit in your presentation, so I am not sure if I'm in an individual or a group insurance plan. How can I find out?
Well, as I mentioned before, one way to tell is that in Ontario, retail sales tax is applied to group insurance plans, but not to individual plans. But you can certainly call our insurance team, and here's a number, but it'll be on at the end, but I'm reading it on my screen as well, 1-877-406-9007. So you'll certainly be able to know from that.
Okay, thank you very much. We have a bit of a process question, and it's actually very good, like the in-between. So how do I transfer from one coverage to another without being without coverage during that process? So Martha?
Okay, sure. So it's a two parts, right? You're starting a new one, you're ditching an old one. So starting your new one, fill out your application form. Get that done. Then check with the insurance plan that you have currently, and they will have a process for canceling your policy. There will be a time limit that you have to let them know. So you advise them that you want to cancel it. You will know when your last date is. So as of this date, I no longer have it. Then you just let RTO know. They will start the day your other one ends. And so you will not have any lag at all. And again, if you got any questions about that process or you're confused, it's that same number. I'm going to repeat it. You've heard it once, and you probably got the first four numbers. We'll give you the rest again. 1-877-406-9007.
Thank you very much, and the insurance team will be more than happy to provide more information. So
They will
thank
be thrilled.
you. So again, about the eligibility, I know we talked about that just a little bit, but I'm not sure if I'm eligible to be an RTO Euro member. How can I find out? How do I get that information? So I know, Martha, you talked about the broader education sector, and
Yep.
Gail as well. How do I know if I'm eligible?
Well, I always say that if you're unsure, call. But if you were a teacher, you worked in the education sector, so you could be early school, you worked at early years, you could work for a school board, you could be at a college, a university, they all qualify. But again, now this time you would be calling the membership team, which is 1-800-361-9888. And if you call them, that's what they do, membership, and they will be able to, you explain to them where you're working, and they will gladly share with you whether or not you can become a member.
Thank you. Thank you very much. Gail, I see the next question. Will there be another window coming this year for those who might wish to take RTO, ERO health coverage? Like any other windows like this one, or more details on that?
I have to say there's no intent to do so at the moment. We've planned at this point in time from February the 1st to April 30th is our window. If the person writing this has a problem with the timing, maybe traveling at the moment, then I would say try and contact our service team at RTO, 1-800-361-9888, and they will assist you in trying to get you started on the path before you come home. For example, if you're away in Florida until after that. But it isn't our intent at the moment. The window is open for this part in time.
Thank you very much. So our next question has come in, and again, thank you so much for your participation and for communicating with us today. This is great. So, I only have extended health coverage. Am I eligible for automatic acceptance into all 3 RTO ERO plans? Martha?
Well, you are eligible to move into the plans that you currently have. So if what you have is extended health, you can move into the extended health. If you have, remember we said the dental, you can move to at any time, but there's a limit on your first year's expenses. And then, what's the other, semi-private?
Semi-private.
Yeah. So if you have semi-private where you are, you can move it over to the RTO semi-private. If you don't have one of those, if you don't have semi-private, then no. Well, I shouldn't say no, I should say yes, but you'd have to have the medical questionnaire and have that filled out. So it depends where you're coming from. That is what you come to an RTO.
Very nice. Thank you very much. So the next question is probably sent by someone who's already with RTO. So Gail, probably for you, how will opening the RTO ERO's plan to teachers registered with OTIP impact on our plan costs? So what would be the impact?
Well, we certainly would see it as assisting potential members if they wanted to come over, whether they're with RTIP or whether they're with any other group insurance plan if they wanted to come over. We have a high quality product, and we also have 95,000 members in the plan. So I would think if the questioner is asking if there's any risk to our plan to have different people come in, I'm sure there's a smoothing process. If I were talking to an insurance person, they'd be talking about that, to have $95,000. I think that was wishful thinking. 95,000 for myself personally. Yeah. 95,000 people in the plan, and then to add more on an open enrollment that's for 3 months. I don't see it as having a terrible, an impact, other than we have more members, which we would be happy to have.
Great, thank you very much, Gail. And in terms of timing, so the next question is, how quickly can I switch my insurance coverage? So, Martha.
Well, it kind of ties in with the question that I just answered. Yes. It will totally depend on how quickly, like we'll take you anytime, right? It totally will depend on how quickly you can get out of your other insurance. So they will, if you read your policy, they will have a cancellation timing, be it 2 weeks, be it a month, whatever. So that will limit when you can switch. You can begin the process yesterday, last week. So you can start it at any time. But then, as I said, you time it, find out how long how much notice you have to give your other plan. You will know the date of your end, and then that's when your new policy will begin.
Okay, very good. Thank you very much, Martha. So we're looking to see if we have more questions coming from you. Oh, here we go. So someone living in another province. Thank you for your question. So I live in Quebec. Is it worth it for me to switch to RTO ERO insurance? Gail?
Any member can live anywhere in Canada for the RTO ERO insurance. So there's definitely an advantage. We would love to have someone in that case. So.
Yep. Very nice. Thank you very much. Oh, and actually, I have to say the question, and I'm so sorry I didn't see it, but the question came in French, so I should read it because it was the way it was sent to us. So we thank you so much, and we're thrilled to have francophone and anglophone participating today. So, je vis au Québec. Est-ce que je peux être assuré par ERO RTO? Et la réponse est oui, bien sûr. Vous pouvez vivre n'importe où au Canada et faire partie de notre plan d'assurance. Donc, comme nous l'a dit Gail, absolument, c'est une réponse positive. Thank you so much. Just to confirm, because it's so wonderful to see our francophone friends participating today.
And maybe even from Quebec, too.
Maybe from Quebec.
Maybe.
Very exciting.
Quebec.
Yes. So, merci beaucoup. Thank you very much. So a question, very good questions coming our ways today. So how does the RTO ERO insurance compare to the competitors? I'm sure you hear this one here and there.
Well, this is a hard one to answer.
Well,
but
competitors,
the short
many
answer is we're the best, okay?
We're
That's
the
the
best.
short answer. We are a leader in insurance. Our insurance program is very specially designed, as we said earlier, for members by members. So we know exactly what our members' needs are, and that's what we build our plan to. And because it's education retirees, people involved with education, that's very much what we sculpt our plan to, your needs. So for you, we are the best. And for your friends who are in education, we're still the best too.
And you know, beyond that too, RTO offers other benefits to being a member. So, you know, a lot of people say, oh, I just joined for the insurance, but many people join for other reasons. We've got so many positive things about our organization.
And you know what, Gail, you may be on to the next question with this, because the next question is, why do I have to join RTO ERO to switch insurance? My current provider does not have a membership requirement. So what would you say? Why should I move? If there's no, or what would be?
Well, but our quick answer to that is we're more than just insurance. Insurance is one of the things we do. We have a number of members, I'm not sure how many, but a lot, who just are members and don't have our insurance. In fact, we keep mentioning some of you today because you have insurance elsewhere. So we have, well, first of all, we're there for not only our members, but seniors. We advocate on behalf of seniors. The executive director and I last week represented RTO in Ottawa on behalf of, we were looking at a national drug plan, which would be a huge benefit to seniors. We look at other issues that involve seniors, and we speak on your behalf, and we go to speak to ministers. So we're always advocating for seniors and seniors' needs. We are a huge social, and I mean, a lot of people join RTO. I was an RTO member before I had the insurance because I still had my board insurance. And I went to the lunches, I went curling, we golfed, I went to Stratford. I mean, I had a great time. And these are all people that I knew, all people that I worked with. So it was a wonderful experience. We do so much more. And then we have so many committees that focus in on goodwill, on political advocacy, scholarships. We do so much.
Service to others,
Yeah.
that type of thing. Yeah.
So we have a number of different areas where we focus on needs of our communities and of our members.
And my reason for joining too, I had my husband's insurance plan. So I didn't need to buy insurance through RTO, but I was used to a life as a federation person, you know, with being in touch with colleagues. Yeah. And that, I love to go to our luncheon meetings because everyone's together. It's principals, superintendents, so the francophones are there, and OECTA and ETFO, and there's a lovely mix of people together, so it is great. I have to say though, when you start to compare our plans with other plans, we are a leader. They're Indeed. Exceptional. The rates are great. For what you have in the plan. And as Martha says, we've designed the plan and it's grown over the years. I've been on the insurance committee for 7 years now, and every year we seem to add something and listen to what a member wants. There's a definite asset to being a part of our plans, for sure.
That's fantastic. Thank you. Thank you, Gail and Martha. So the next question is, I noticed that RTO ERO only has one plan for everyone. wouldn't it be better for me to be able to pick the exact plan that meets my current needs? So, Gail, what would you?
Well, you know, our needs change throughout retirement, and we know that, you know, when we first retired, we probably wanted, well, in my case, you know, I wanted to travel. That's why I ended up picking up the extended health care, even though. And as time goes on, there are different things. I think our plan, insurance is designed to protect you for sudden and unforeseen things and illnesses in your future. And I think our plan balances that for all the different types of members. So one plan seems to work very well. And certainly the testimonials we've received indicate that also.
Wonderful, thank you. So, here's another question about geographical situation. So I'm planning to move out of Ontario in the near future. Can I still switch to RTO ERO insurance? Martha.
When you pack your luggage, you just stick your RTO plan in there and take it with you. So it travels with you wherever you are. So you can be anywhere in Canada. You can be anywhere in Canada and still be covered by our plan. Absolutely.
That's very nice. And I see the other question actually is probably in relation to this or continuation of this. Must the applicant have worked in Ontario? So do you want to continue?
Continue on that? Well, sort of a little bit different, but the stipulation is that you have to have been in education. So you've retired from some related to education job. That's it. You can be a member, absolutely.
Very nice. Thank you very much. So maybe this one for you, Gail. Does the RTO ERO offer any other insurance beside extended health, semi-private hospital, and dental?
Well, they do.
And the question actually said, and are these plans also covered by the open enrollment offer? Of course.
RTO ERO provides term life insurance, long-term care, and home and auto insurance as well. The open enrollment that we have in place right now from February 1st to April 30th is only for our extended health care, semi-private hospital, and dental plans.
Very nice. Okay. Thank you. Another question here. So I am an RTO ERO member and I don't have insurance. Why can't I get in on this open enrollment? So Martha, what would you?
That's, I mean, we feel for you, but during this open enrollment, as we've already said, you have to transfer based on the fact that you already have the insurance. We would be taking a huge risk if we just opened it up and let anybody come in, because if we start allowing people in who either can't get insured through other companies, that's a financial risk for you, because if we start accepting people in who have, for some, see, we don't know why they don't have a plan. The plan might be they just never got around to getting it, or the plan could be because they have medical issues. And it's a risk that we're not willing to take for you. We need to know that the people that are with us, and if they're coming from another plan, they've already been in that plan, so they're moving over. It doesn't mean that their risks are low, but it's a better, their risks aren't low, but it's a better risk for us. And that's primarily why we don't do it.
So once again, like, you can get RTO ERO insurance, but you would have to go through the process.
Yeah. Very good. So I'm sure it's a question that you can both answer in different way because it's so personal, but what makes RTO ERO insurance special? So Gail, do you want to start on this one?
Well, we have great feedback from our members about the plans that we have. We have had a member survey within the last year, right, Martha?
Yeah. Mm-hmm.
And high satisfaction rate, 90% satisfaction rate by our members. Once again, it's that designed by members for members, and I think that's the strength of it as well. So, Martha, you may want to add anything to that?
Well, no, it's exactly what you've just said, and we've repeated it. It's because we design it, we control it, we manage it, and so it's for you. Anybody out there could be on the HSIC committee and have control over what we're doing and how we're doing it. And that's what makes it so amazing. It's not some outsider, it's us for you.
And we continue every year. We, as I said earlier
Yeah.
on, we look at suggestions from members, and we say, all right, what's that going to cost the plan? Because of course that's our role now. Martha is on the committee, and we have to look at it fiscally responsible, but we do look always to see, okay, what would members need?
That's right.
How can we help them out? How can we enhance their lives?
Yeah, and we always ask the question when we're looking at the suggestions you send to us is, how many people would use this? And then another factor we always look at is not only how many, but to what degree, because sometimes something little will affect many people, and then that's something we would consider. Mm-hmm. Sometimes it doesn't affect many people, but it affects them in such a significant way
ways, yeah.
that would be something we consider. So we can do that. We can sit and look and make those decisions for you.
Spend a fair amount of time doing it.
Oh,
We probably,
my gosh.
Probably
Yes, we do.
4 meetings a year for sure.
We
right?
do.
Yeah.
Very nice. Well, and Gail, you were mentioning you've been in the committee for 7 years, so you've seen the plan being enhanced
I have.
and seeing how the voice of members is being, reflected in.
Actually, I have to tell you, I'm very proud of the work we do. Very proud of it.
And just another thing, everybody on the committee has to take a 5-part university course to be able to be on the committee, and you have to have a significantly high mark. Like, it's a little scary, but we're all trained. And then every meeting that we have, so 5 times a year, it's preceded by 1 day continued training. So we are always upping our game to make sure we're on top of what's going on and that we follow the insurance, the whole insurance legalities, and make sure that we're exactly doing what we need to do.
Mm-hmm.
Very nice. Thank you so much. And a question is coming to us again from someone in Quebec. So it's nice. We have our friends everywhere here with us today. So the question is, I live in Quebec and I work with a school board here. Can I get your insurance? So, Gail?
Yes.
Martha, I mean,
Yeah,
I know
you're definitely
you've discussed it.
welcome to get insurance. You're to join us and get insurance. Because you live in Quebec, you still will have to, like as in Ontario we have OHIP, you'll still have to work through RAMQ, which is the provincial government coverage there as well.
Okay,
So.
good to have those details. So we have our next question has arrived, and the question goes, it starts by hi. Well, hi back. Hi, I retired in May 2015 from teaching, and I am an RTO-ERO member. We have been with my husband's insurance company. He retires at the end of August 2017. Please advise if I should be enrolling at this time. So what would you suggest, Martha?
Well, hi, Jeannie. I'd have to ask you what your husband's insurance is. Because that is a question, and we don't know if it's a group or an individual. Correct?
Right.
I'm looking at you for that one.
Well.
Because if it's an individual and you're both being covered by that individual, and then at the end of the year you want to join us, that would be problematic. So in that case, I would say, yes, join now. But if it's a group insurance, so I don't know if he works for a school board and you're still using the school board insurance, you're good. So for the group insurance, no problem. When he retires, that you can move directly into ours do it within 60 days. You can move into our insurance plan. So you've got to do a little bit of homework. You've got to check and see if you're in a group or in an individual plan. Individual, yes, I would do it now. Group, you can be more leisurely and wait till he retires.
Mm-hmm. Yeah, there you go. So does this include auto, home, and life insurance, Gail?
No, the open enrollment, we've just put it in place for our health plans, so it's just for our extended health, hospital, and dental. But if you want to know about the other plans, you should call the insurance team, which was, I think, a 1877 number, but you'll see that at the end of the broadcast.
Yeah, very good. Okay, so we're waiting for our next questions, and again, we really wish to thank you for all the questions that have come so far. It's just wonderful to know that
These are great.
These are
Really good
great questions. And again, for this, and open enrollment windows, just knowing that you have questions and we can dialogue live like this is really precious for us. So let me see. Our new question has come. My husband is not an RTO ERO member and is not eligible for RTO membership. So he was able to join OTIP with me. Can he switch to RTO as well as myself? So, Martha, do you want to take this one?
So, lucky for him, he's your husband. You can join and bring him with you. We'd love to have you both. So absolutely, there's no problem. You can both move over, and we'd love to have you.
Okay, fantastic. That's good news.
That is good news.
Very good. And it's good to have those clarification when it comes to the spouse. And so we're looking to see if we have another question coming in French, English. They're all welcome. Maybe you've presented so well that you've covered most of it. And again, we will provide all the information, but if for any other questions, we can, people are always able to call. So we have a new question that has come. I'm planning to, I think we had seen this one, right?
We've seen one. Yes, I think we've seen one similar to this.
Yes. Yeah, I'm planning to move out of Ontario in the near future. So this one is the near future, maybe without a date. Can I still switch to RTO ERO insurance? Gail?
Yes, of course. Yes. Anywhere in Canada, you can have your RTO ERO insurance, definitely.
So that's good to know. Anywhere in Canada. We're going to see if we have more questions. I think
we might have to ask each other some questions.
I know. I think we've done. Okay. Must I have to have been employed only in Ontario? So I think there's still a lot of question related to the provinces. So Martha.
I love that this question's very interesting. Must I have been employed only in Ontario? No. In fact, you don't even ever have to have been employed in Ontario. As long as you were in the education sector, wherever you were, then you're welcome in.
Very nice. So we have a new question that has arrived. I don't have any insurance. Can I get into your insurance now? So Gail, I know we had a similar question earlier.
Similar, but I know it's a good question because someone may not have heard, typing it in, they may not have heard this one. But the open enrollment is only for those people with individual insurance plans. So if you don't have any insurance, you can apply for insurance, but you're welcome to submit an application, but you still have to go through the medical questionnaire.
Okay. Very good. And we're going to see if we have another question coming our way. Okay, so here's our next questions. Could you define education worker? So I think maybe a bit more information on that broader education sector.
Okay, and we do keep saying, we do this all the time, so we forget that you may not know all the fine tuning. So we always say the broader education, so teacher, of course. But the truth is, have you been a secretary in a school? That you're working with education. Oh, let me tell you, you're working with education. A custodian in a school, absolutely. An early childhood educator. I'm secondary, so the terminology is not the best with me.
Support staff of any type.
Support staff.
It's an EA.
That's right. So as long as you were in some way affiliated with education, then
and post-secondary.
You could have been in a private school. You don't have to be in public system.
Yep, we're very open.
Very open, yeah.
Okay, so this is good. This is broad. So we have a question coming in French now. Thank you so much for being with us and participating. So I'm going to read it in French first because this is the way it came to us. J'ai entendu dire que vous avez un programme d'affinité. Est-ce exact?
Oui.
I heard, you understood that one. I love it. I heard that you have an affinity program. Is that true? So, Gail, do you want to take this one?
Oui.
Oui. So, la première réponse, vous l'avez eue? La première réponse de Gail, c'est oui, c'est une réponse positive. So, je vais laisser Gail expliquer en anglais. Yes.
I would try to do it in French, but I might embarrass myself. Yes, we actually just in January 1st of this year, 2017, it's embedded in our extended health program, but it's a program called Member Perks with Vengo. And there are over 1,200 discounts possible within that program. It's fascinating, actually. It's tuned to you. You know, you have your little app, and you can tune it to anywhere where you are, GPS.
Last night, we took the Health and Insurance Committee out for dinner. There were 10 of us. Restaurant looked at 15% off, so
Yep.
it works.
Lots of perks.
Yeah.
That's amazing. What a gift. This is great.
It is great.
So thank you so much. This concludes our webcast for today. As we discussed before, the archive of our broadcast will be ready early next week, and we will send out an email when the archive is available. Thank you to our presenters, of course, Martha and Gail, you were fabulous, and to all of you for participating in this exciting webcast this afternoon and being with us. And we look forward to engaging with you again very soon. Have a great afternoon.